acceptance, and I'm going to overview some of the general ideas inside of size acceptance, and then we're going to talk about some of the specific problems that arise, the conditions that are a result of problems with size acceptance. So one of the important ideas with size acceptance is that healthy people come in all different sizes. The idea is that the image that the diet and media industry promote is deceptive, and that that's not realistic for most people, and that healthy people come in all different shapes and sizes. Second idea that's important is that size is not your identity. It's just one of the many different things that describes you. So your self-worth shouldn't be based on size. Your self-worth as a person is based on things that are a part of your character, such as integrity and dependability, and not just on your size. That's just a very small piece of it. And finally, a third important idea with size acceptance is that all people have the same civil rights regardless of what size they are. So for example, you can't do employment discrimination based on size. So these are the 4 ideas that we talked about in class that are involved in any effective long-term diet plan. And so for example, just because you have size acceptance doesn't mean that you throw out healthy eating. It doesn't mean you're happy with your size, so you just eat whatever you want. Rather, it means that the goal is to make positive choices and to eat right and to not eat a certain way so that you become a certain size. For example, you just focus is on the healthy eating habits, and you sort of let size fall out wherever it may. With physical activity, for example, you don't want to punish yourself by running on the treadmill for 3 hours a day till you get to a certain size. That's not the right kind of idea. Rather, what you do is you establish an effective program that's realistic for your level of fitness, and the goal is for you to get in better shape. And you establish something that you can stick to. And you don't focus on size. Rather, you focus on getting in shape and being healthy. And then size, is sort of a secondary aspect of it. These last 2 that are behavior change and attitude change, it's almost like you have to have size acceptance first, that your attitudes must be right. Accepting yourself for the size you are is like the part of having the right kind of mindset for a successful diet program. And only once you accept that, then can you really begin to change. Okay, this last poster just underscores that people come in all different shapes, healthy sizes. So for example, this was a study of about 12,000 participants tracked over 12 years, and they just recorded mortality rates. So you have underweight, you have normal weight, you have obese, overweight, you have obese, and you have class 2 obesity. And then these are the relative risk of mortality over the course of the study. And so the way they set up the statistics, normal weight people have a 1.0. And then what you see here is that actually people that are overweight had lower mortality risk than normal weight people. And you see that not until you get up to class 2 obesity, which is a BMI of over 35, did you have higher risk. And then finally, the highest risk of all was the people that were underweight. And so this just shows that the small sizes that might be promoted by the media are not necessarily the healthiest.
The National Association for the Advance of Fat Acceptance is an organization to make the public be more aware of size acceptance. Many websites that demonize obesity are backed up by weight loss companies and surgeons. People need to learn that just because you're obese or overweight does not mean you're unhealthy. The idea of size acceptance and health at every size movement says you should accept yourself and your body the way that you are now. Emphasize good healthy habits in nutrition and exercise without being rigid or restrictive. And finally, work for a stable weight and better fitness instead of for weight loss as your primary goal. Some people, due to genetics, metabolism, and set points, don't have much control over their size and may actually be healthier at a greater weight than at a so-called normal size. Medical belief is that weight loss is always the answer, which is not always the case because significant damage can be caused by long-term dieting due to trying to lose weight. Binge eating, bulimia, and anorexia can be caused by diets. As a population, the more we diet, the fatter we get. Dieting teaches you to ignore your internal appetite, underlying the very mechanisms that helps people eat normally. And dieters are also more likely to have hypertension. Research shows that fat people don't eat differently than thin people. Both binge eat. It is important to notice your quality of life and how you feel rather than your weight. Fat people do not have more emotional problems than thin people, which is a common misconception. Many people stereotype bigger people with that. There is no obese personality type either. Anyone can be at risk for being obese. An equal number of skinny people have problems with self-image as much as fat people do. Fitness is more important than weight. And in a study, fat, active men live longer than sedentary men. You should exercise to be healthy rather than to be thin. If you do it to become thin and then you don't, you will give up.
I'm going to talk to you for a few minutes about body dysmorphic disorder. Body dysmorphic disorder is a type of chronic mental illness in which a person cannot stop thinking about a flaw with their appearance. The flaw can either be minor or imagined. A person with body dysmorphic disorder is usually ashamed of their appearance so much that they do not want to be seen by anyone. This illness has sometimes been called imagined ugliness. The exact cause of body dysmorphic disorder is still unclear, but many experts believe that it is related to a chemical imbalance in the brain, obsessive compulsive disorder, and eating disorders. It is usually more common in women than in men. Research also shows it usually begins during adolescence because it is the time when people are most sensitive about their appearance. When somebody has body dysmorphic disorder, they obsess over their appearance and body image. This can last for several hours throughout the day. Some people go to the extremes of having plastic surgery to try to fix the flaw, but are still not satisfied. Somebody with this disorder will have obsessive thoughts, delusional thoughts, social and family withdrawal, anxiety, low self-esteem, feel self-conscious in public, and attempt to seek perfectionism. Some compulsive behaviors with people of this illness will constantly check themselves in a mirror, have excessive grooming behaviors, excessive dieting, compare themselves to someone else, attempt to hide the imagined defect, avoid social situations, pick at their skin, refuse to take pictures, and constantly seek reassurance of the perceived defect. Somebody struggling with body dysmorphic disorder should seek therapy. Treatment for this disorder usually involves both therapy and medication. Cognitive behavioral therapy will focus on teaching healthy behaviors and help someone to learn about their feelings, conditions, thoughts, moods, and behaviors.
Okay, I'm going to talk about anorexia and bulimia, and I'm going to talk about how the media affects our young people and their size acceptance. 42% of 1st to 3rd grade girls want to be thinner, and 81% of 10-year-olds, both male and female, are afraid of being fat. Magazine pictures influenced 69% of 5th through 12th grade girls' perceptions of the perfect body shape and made 47% of 5th through 12th grade girls want to lose weight. Children and adolescents that suffer from eating disorders have most likely suffered some sort of abuse that triggered such a traumatic response. These wounds manifest themselves in eating disorders that are fueled by the media and the nation's obsession with the perfect body. Anorexia nervosa is not easy to diagnose in children and adolescents. The definition of anorexia nervosa, among many other eating disorders, takes into account children who do not have normal growing patterns, children who have not yet experienced puberty, children who have experienced puberty, and children who have a tendency to look emaciated into one definition. So that's why it's really hard for them to diagnose, because they lump all these kids together. Anorexia is clinically defined as an individual that drops below 85% of their ideal body weight and is unable to maintain a healthy body weight. Childhood and adolescent anorexia nervosa is defined as determined weight loss, mainly through food avoidance, abnormal cognitions regarding weight and shape, and a morbid obsession with weight. It is often hard to diagnose a child or adolescent with anorexia nervosa because, even though a parent might notice that they are not gaining weight or their eating habits have changed, general practitioners are wary of diagnosing an adolescent with anorexia nervosa. They diagnose the adolescent with some other physical problem, and the disorder can go unchecked for quite some time. This misdiagnosis allows the adolescent's disorder to strengthen and delays the introduction of treatment for anorexia. Some signs and symptoms of anorexia nervosa are an intense fear of gaining weight, highly restrictive eating to encourage weight loss or avoid weight gain, self-starvation, continuous dieting, excessive exercise, absent or irregular menstruation, hair loss, sensitivity to cold, and excessive body or facial hair due to inadequate consumption of protein. It's unclear what causes some people to develop anorexia nervosa. Some hypothetical causes include factors of biological, psychological, and sociocultural origins. Biologically, if an adolescent has a mother or a sibling with anorexia nervosa, they are at an increased risk of developing the eating disorder, though it is unclear if this is caused by a chemical imbalance in the brain or the adolescent being exposed to such behaviors in their mom or their siblings. According to the author Bulick, another example of biological factors that can influence development of anorexia nervosa in childhood or adolescence are perinatal factors such as being small for gestational age, premature, having cephalohematoma, which is a collection of blood between the scalp and the brain of a baby caused by pressure at birth, and any subtle brain damage at birth could result in increased difficulty with feeding and later lead to a higher risk for anorexia nervosa. This only makes up about this makes them about 3.6% more likely, so it probably is not one of the reasons. Some psychological factors include obsessive compulsive disorder that allows an adolescent to stick to a strict diet and go without food for long periods of time. Some other psychological factors that could cause anorexia are low self-worth, an extreme drive for perfection, depression, or sensitivity, which have all been traits that are associated as part of this disorder. Sociocultural factors that could cause anorexia nervosa is the tendency of modern Western culture to be obsessed with thinness. In modern Western culture, thin models and actors are highly esteemed and are very successful. This view could only have some impact on the formation of the disorder, however, because there is evidence that anorexia, among other eating disorders, existed long ago. As stated earlier, it is easy to see why this disorder affects older teenage girls. Their role models are obvious and in your face. Young adolescents, however, are affected by the media too. We just don't realize they're paying attention. In the book, Body Image, Eating Disorders, and Obesity in Youth, Assessment, Prevention, and Treatment, one of the authors had an interaction with his son that showcased how much media truly does affect children and adolescents. Kevin's son Jared, at the age of 4, declared to him, "Dad, you need to lift weights." A bit stunned, Kevin recovered sufficiently to ask him, "Where did you get that?" And Jared smiled and said, "I saw it on television." Jared, at 4 years old, realizes that men that have large muscles and are hard-bodied are the standard in the media. His little 4-year-old mind has made this connection. As he gets older, it will most likely plague his thoughts and affect his behaviors. Now, bulimia is another eating disorder that affects children and adolescents, but is rarely seen because most adolescents just restrict their food. They don't go through the whole binging and purging cycle. So we need to make sure that our children know their self-worth. It's up to the parents to encourage their children to make them feel that they are beautiful, because being thin is not necessarily meaning that you're healthy. Size acceptance is about knowing that it's important to have a strong body, be grateful for what your body can do, and it's not about being thin or being overweight, it's about being healthy.